Welcome to our webinar this afternoon. We are from Alzheimer's San Diego. My name is Jean Alton. I'm a senior dementia educator with Alzheimer's San Diego. And together with my colleagues and our tech team volunteer, we will be presenting on driving and memory loss. A big and important topic, and one that always brings a fair amount of emotions to the table, because we all, I think, if you drive at all, we strongly identify with our driving skills, our cars, our independence. And so this is a big hot topic. We're going to delve into things and hope that we can impart some knowledge upon you folks and answer some questions as well too. So let's get started, shall we? So I am pleased to be co-presenting today with my colleague, Serena Barker. Hey, Serena.
Hi, everyone. Good evening. Nice to have you.
Serena is an MSW, Master's of Social Work, and she is our Director of Clinical Services. So she oversees this fantastic team of people, of my colleagues that just all together are just have an amazing amount of knowledge and resources and information at hand to share with all of you folks, not just here today, but also, through the week. So any questions or concerns you have regarding this subject area or any subject areas, please contact us. And let us know whatever your questions might be. So, and to that end, then I will invite Gabby to come on and say hello as well too.
Good afternoon, everyone.
Hi, Gabby. And Gabby is a member of this tremendous team of clinical services coaches. And Gabby will be our social work support here today. So any questions that you have, Gabby will be managing both in the Q&A and in the chat. And then she will be directing those questions to Serena and I as we go along. What we'll be talking about is, amongst other things, how dementia affects driver safety, and trying to, connect the dots for all of us about how it becomes an issue over the course of time. It's not necessarily an immediate issue, but it is something that transpires over time when we're dealing with the diagnosis of some type of dementia. We want to talk about recognizing the signs of unsafe driving. What does that look like? And when and really how to intervene. And part of that process, we'll be talking about collaborating with other resources to help with that whole process of intervening. And that means collaborating with physicians and the Department of Motor Vehicles. And in addition to that, there are a variety, many, I actually will say, local resources for driver safety, evaluation, and transportation alternatives, all of which is really quite amazing. And I will be talking about that towards the end of today's presentation. And we will be giving you specifics on websites to go to. And I really would encourage all of you to do some exploring of some of those resources, because they are fantastic. They really are, and offer some great information. Okay, so I am actually going to turn it over to Serena, and she's going to start by talking about how, here we are, what is dementia, but also how dementia affects driver safety. So Serena, I'm just going to disappear and.
Right. Thank you, Jean. Well, I'm not going to go into too much depth about what dementia is, because we have other classes that talk more about brain changes and the different stages of dementia, but it is important to acknowledge what it is in comparison to driving. So dementia is a group of symptoms caused by an underlying medical condition that impairs cognitive function, causes behavioral changes, and interferes with normal activities. So oftentimes we see the memory loss. We might see difficulty with language comprehension, difficulty with decision making. When it comes to behavioral changes, oftentimes individuals can feel isolated or depressed or upset and frustrated. And then really when it comes to interfering with normal activities, that's where we see it more in connection with driving. So I'm going to talk a little bit more about that in the slides ahead. So how does dementia affect a driver? When we hear the term dementia, most of us think of memory loss first. So that's pretty obvious, right? With memory loss, a person could forget to turn on their headlights. Maybe they forget to turn on their windshield wipers if it's raining. Maybe they forget to turn on their signal to change lanes. All of those things can put a driver at greater risk. But orientation is also really important. So when we think about a person getting in a vehicle, all you have to do is make one wrong turn and you get lost. And then I know for myself, if I'm lost somewhere, I typically try and find the nearest main street. So I go even further into getting lost at times to try and find my way. So for someone with dementia, they could really get out of their normal community just solely by trying to find their way back home. Judgment is another big factor, right? When it comes to driving, all of us have to make good judgment calls constantly, not just for our own selves, but for everyone else on the road. So judgment meaning knowing the distance from your vehicle to the one in front of you, having good judgment to know the speed to go in order to change lanes and make sure that you're not cutting that person beside you off. Also, just judgment in having good driver etiquette. When it comes to behaviors, this is where we typically see individuals with dementia getting more flustered or frustrated. Maybe they are more likely to have some road rage in some sense. Again, because there's a lot going on in that vehicle that a person has to pay attention to and focus on in order to get to where they're going safely. Sensory changes is also a big factor. When you think about how powerful our brains are, each lobe of our brain is responsible for something different. So as the disease does progress throughout the brain, we recognize that hearing may become an issue. So if there is an ambulance coming from one direction or another, it's important that we can hear and react and respond and know to stop and pull over. We also acknowledge that sometimes if a person is driving and maybe they run out of oil or there's something going on with the engine, the smell of that vehicle can trigger us. Hey, something's wrong. I need to stop. But someone with dementia might not recognize that that smell is coming from their own vehicle. And when it comes to narrowing visual field, all of us in our 20s have the peripheral view to see our hands beside our face. But naturally, as we age, that peripheral field changes and gets smaller. But particularly with someone with dementia, their visual field becomes this small. So in order to see what's coming in either direction, they have to know to turn their head. And so all of these changes really make it difficult for a person with dementia to drive safely every single day. And that brings us to a public health issue, right? So why is driving and dementia related to public health? What we know is that your brain is just as old as you are. So if you're in your 60s, 70s, 80s, even 90s, right, your brain is that old too. And so naturally, our bodies are going to change. But when someone has dementia in particular, we recognize that drivers over the age of 75 do have an increased risk of collision with every mile that they drive. So if you have a person who's running errands, going to the grocery store, going to the doctor's appointment, going to visit with a friend, that's a lot of mileage in between that's really putting them at greater risk for an accident. And unfortunately, the rate of fatalities does increase slightly over the age of 65, but definitely more significantly over the age of 75. We know that age is the primary risk factor for anyone developing dementia. We know that 1 out of 9 people over the age of 65 will have dementia, and 1 out of 3 people over the age of 85 will have dementia. So it does create an issue in the community where individuals feel capable, feel like they've had a clean driving record for a long time. But when it comes to dementia, that doesn't have anything to do with what a person's been able to do over time. So now I'm going to talk a little bit more about the signs of unsafe driving and how to intervene. What is it that we need to be looking for? And so this slide in particular is for individuals who are observers or they're a passenger in a vehicle to someone who might be showing signs of dementia. We know that there's a decrease in their confidence. Maybe they recognize, hey, I don't feel comfortable driving at night anymore. Or maybe they'll say, I don't think I should be driving on the freeways. I'm just going to take the back streets. Or maybe they just don't want to be driving by themselves. That's a sign that they're recognizing that their abilities are changing. Poor lane control means that an individual could just be swaying in that lane and possibly drift into another lane. When it comes to inappropriate speeds, older adults don't tend to drive too fast. It's actually the opposite, that though they may be driving in the slow lane, they might be driving too slow for a safe driving speed. So that does become a concern, right? Because individuals around them could be getting frustrated with them or doing other things that can make their anxiety or their frustration even greater. When it comes to trouble navigating turns, this one's interesting because when you think about all of us turning, we have to know the depth and the distance from the vehicle to an object. In addition, if you've had your car for over a year, most of us know the dynamics of our vehicle, right? Not to go too far this way or if you're backing up, when you're not going to hit the bumper. And so if you're noticing more tire damage on a vehicle, it's likely because someone is having difficulty navigating those turns and they're probably hitting more curbs than they should be. Again, if a person is becoming more easily angered, confused, or distracted, that's a sign right there. I mean, you think about being in a parking lot or being in traffic and how quickly people might weave in and out, or someone might cut right in front of you and take that parking spot. And it's frustrating for all of us, but particularly with someone who has dementia, they need to focus. And when too much is going on, it can create that reaction in them. Making poor decisions as well. Again, this could be something like moving into another lane, not recognizing the distance from their vehicle to another. And with slow response times, we know that people who are living with dementia, it takes a while for them to process information differently than they used to. So their reaction time to slam on their brakes or their reaction to know that something is coming, right? That safety awareness. Remember, I talked about that peripheral view. Their safety awareness isn't as strong as it used to be, which makes it so they can't react like they once did. And then, of course, making errors at intersections. So maybe not stopping well enough or not yielding, maybe going through lights are all definite signs of unsafe driving. Now, when it comes to family members or friends, maybe neighbors, people who are observing the person with suspected dementia, you might notice that they park inappropriately. So if you've ever been maybe in a parking lot, you've seen those cars where you think, my gosh, why is that person parking in 2 spots? They didn't need to do that. Their car's not that big. Or you might notice that individuals could park on their grass or on their lawn and not in the driveway. We also see some individuals pull too far up in the driveway where they hit the garage. All of that is definitely a sign that something's going on. If you are concerned about somebody driving and having dementia, it's important to look at the vehicle. You know, every time you go over there, just are there any new dings or scratches or dents, things that could acknowledge they did get in an accident. They might not always remember how it happened or when it happened, but again, it's something happened. Individuals may report near misses or close calls, right? It's often that they say, oh, someone must have hit me. It was a hit and run. When really, again, maybe they just don't remember that the incident had happened. Other drivers frequently honking their horns. I know not everybody uses their horn appropriately, but for the most part, horns are used for safety, right? If there's an issue, if there's going to be an accident, if you know, someone's getting too close to another vehicle, we use our horns for that purpose. And so if someone's using their horn or honking frequently, it can tell us that someone's not using good driver etiquette. And there's a change in the driver's skill that's really creating more and more people on the road to acknowledge it. Also, forgetting how to locate familiar places, that goes along with just the orientation of dementia. Knowing that where something is, but actually getting in the vehicle and going there could be problematic. And then returning from a routine drive later than usual. That's a huge one that we hear from a lot of our clients, where someone, you know, maybe they go to church every Sunday, or they do their grocery shopping every Wednesday evening. And usually that event takes 1 to 2 hours, but now a person's gone for 5 hours. That's concerning, right? Where were they and are they okay? This reminds me actually of a personal story that I have where, you know, my grandfather came from the Great Depression. And so when he got into school, you know, he had to, he didn't graduate because he had to enter the workforce. And his choice of career was working with automobiles. So from a very young age, he knew everything about vehicles, and he eventually opened up his own auto body shop. And everybody in town would come to him because just by listening, he was one of those people that he could tell you exactly what was wrong and he could fix it too. So when it came time for him, he did have Alzheimer's disease. He was in the earlier stages actually, and my family, we weren't aware. We didn't have these types of classes back then. And gosh, if I only knew then what I know now, things would be different. But my family thought, you know, he knows this stuff. Like, even if he got in the car, he'd figure it out. He's fine. It's just memory loss. And unfortunately, one evening he wandered. He left the house and he was gone for 17 hours. And it was cold outside. And he just had a t-shirt on, a t-shirt and pants, and that's it. And I tell you that 17 hours was the worst 17 hours of my family's life because we didn't know where he was. And it's not like him to be gone for so long. And so I share that with you because eventually there was a good Samaritan who found him. He ran out of gas and ran into a tree. He didn't get hurt, but the good Samaritan acknowledged he's not, something's, you know, he's disoriented, he's hungry, he's dehydrated. and he wandered. So thankfully he returned. But I share that with you because, Jean, if you can go ahead and click to the next slide, please. Wandering happens all too often. And I can't tell you how many times our clients call in and say, oh, there's no tendency of wandering right now. I don't see any signs. But unfortunately, all persons with dementia are at risk. And we know that at least 60% of people will wander or become lost at some time. And so my family, we waited for a crisis to happen in order to do something. And I can't encourage enough to not do that, because sometimes people wander and they don't come back. And so it's important to just really think about safety, think about your family, and so much about dementia and driving is out of care and concern, right? But wandering does happen by foot or by vehicle. It can happen, like I said earlier, just by making a wrong turn and then getting disoriented. Some common causes of wandering are the disorientation and confusion, right? Someone is trying to find their way back, and in doing so, they just get further lost. Memories of past activities. This reminds me of how some individuals just revert back to having that routine. Maybe they, like my grandfather, he worked 15-hour days every day. So it was normal for him to get up at 4 a.m. and get in the car and go to work. So people with dementia can actually go back to those routines and think, oh, they may not recognize they've been retired for a long time, and know that, oh, I have somewhere to be, so that's where I'm going to go. Other reasons for wandering could be that physical need or discomfort. So maybe someone's on their way to the grocery store like they usually do, and now they have to use the restroom. So they pull over to a gas station and go, but then when they get back in their car, they're now confused. Where am I? Where's the grocery store in correlation to this gas station? And of course, the agitation and restlessness. So the pandemic really has not helped individuals get out of the house and maintain routines. But what we find is that if someone, before they started showing signs of dementia, did have a very active lifestyle and maybe a regimented routine, keeping them at home, not doing anything, is actually something that can create that restlessness, because they can feel like they have somewhere to be. And if they see a vehicle, then it's, oh, yes, that's right. I, need to go meet my friend for coffee, like I always have every Saturday morning. We do hear these messages all the time. He has lived in this neighborhood for over 30 years. He knows his way home. My grandfather knew cars and vehicles for 60 plus years, and yet he still didn't know how to get home. I make sure that she tells me where she's going. Before dementia, yes, absolutely. These are appropriate to say, but when it comes to dementia, you just don't know when it's not going to be a good day, or when there will be a lapse in judgment, or when someone will have confusion. And you don't want that person to find themselves confused or not knowing how to get home. So this stop sign, if all the information we've covered so far is ringing true for you, and it makes you feel like you or someone needs to stop driving, let's talk about what's next. What do you do when someone needs to stop driving? And maybe you've had the conversation, or maybe you haven't, but what options are there? Jean, I would love to transition to you to talk a little bit more about that.
Rena, and I just want to say really thank you for just sharing that about your grandfather. I mean, there really is something about these personal stories that really extra resonates with us. And I have just been sitting here trying to imagine those 17 hours for all of you as a family. And, I can't, other than to say it must have been just horrible.
Well, and you think that all the, yeah, why did we not do something about this? Or how could it have been different? And it's a horrible feeling. You don't want anyone to feel that way.
Yeah, and like we all say at different times, hindsight is 2020.
Right.
And through this presentation, as Serena has already said very succinctly, is we want to arm all of you with information and resources and the impetus to put a plan in place so that you don't have an experience like Serena's family did.
Yeah.
We don't want any of you to have to go through that. And we certainly don't want the people that you are caring for with the diagnosis of dementia to go through that either. I mean, I just think then about your grandfather and how horrible that must have been for him. Frightening and confusing and distressing, and oh gosh, yeah. So let's continue on here and figure out, what do we have at hand to rely upon, to use as resources, and to use as collaborative tools. Okay, so, and to that end, we're going to talk specifically about collaborating with physicians and the Department of Motor Vehicles. But before we do that, here's this great quote from Dave Barry, who is, the humorist, and this guy just often just says it so perfectly. And this statement sums it up, I think, perfectly. The one thing that unites all human beings, regardless of age, gender, religion, economic status, ethnic background, is that deep down inside, we all believe we are above average drivers. Now, do you agree? Is that not true? I know in our family, when we sit down and talk about driving, it's usually within the framework of somebody that was, we weren't happy with the way they were driving. A stranger, on the freeway or whatever, did this silly thing, and oh my God, I can't believe this person had their license. We all, truthfully, in our family, we all talk just like Dave Barry said, like we're the best drivers in the whole county of San Diego. And I think most people are that way. So, and I just think it speaks to our strong identification of ourselves as drivers, as independent drivers and good drivers. So let's keep that in mind as we go along. That's one of the reasons why it makes this whole thing tough and sticky and challenging and all sorts of other things. So we'll start with working with the doctor. So this is some important information here. So I'm just going to go kind of step by step. There's a lot of misperceptions about kind of how the doctor works in this whole driving business and how the DMV works in this whole business. So I'm going to try to explain it here to you. So we'll start with this, the doctor. And often the questions we get is, is the doctor mandated to, report a diagnosis of dementia? And the answer to that question is a straightforward yes. When it's a diagnosis of some type of dementia, doctors are mandated to report that actually to the Department of Public Health. And, it's not limited to dementia. It's some other conditions and diseases as well too. If a person were to have a loss of consciousness, maybe they fainted when they were ill, or they fell and hit their head and had a loss of consciousness, that would require a report. A diagnosis of some type of epilepsy would require a report. So there's other, just to note that there are other medical conditions and diagnoses that require this information. Why is it required? Because it's a liability issue. It's a huge insurance issue, and for the doctors as well too. So it is something that is mandated that they make this report to the Department of Public Health. From what I want to say though is it's not a one size fits all report. So in other words, the doctor has the latitude to be able to make the report with addendums to it, with add-ons to it, where it might say, for example, yes, the person's been diagnosed with dementia, but it's early, and the physician is writing still okay to drive. And so that additional information is going in with the report. Conversely, it might be the diagnosis is dementia. There's significant change in cognition, and the reporting doctor might recommend ceasing driving. And so that information goes in to the report. So just for everyone to understand, it's not one size fits all. Some of the misperception here is that it's right away, you have a diagnosis and you're going to lose your license right now. And that is not the case. So there is latitude for the doctor to be able to have this additional information going in with the report. The factor, as it says here, is not the diagnosis itself, but individual driving ability. So the report is made to the Department of Public Health, and then it is forwarded on to the DMV. Whatever is contained within the report is what the DMV is considering. And we'll talk about that in the next slide. In the meantime, though, what we think is really important is to have these conversations and collaborations with the doctor to get the sense of what is the doctor going to put in the report. Not only that, but for the doctor to say verbally to you as a care partner and potentially the person with the diagnosis as well too, what the doctor's perception of how the individual's functioning is and if that individual should or should not be driving. And so to that end, that gives you more information, from the perspective of the medical professional. And it also can be a part of then obtaining doctor's orders or a prescription regarding driving. And this can sometimes be very helpful for families, whereupon the doctor is maybe saying, I don't want you driving anymore, or I want you to restrict your driving to the daytime, or I only want you driving in your own neighborhood with a family member present. Well, I mean, can be whatever, kind of you and the doctor collaboratively come up with. And then it can be written down so that it can be something that is presented to the person with the diagnosis if and likely when they forget about this particular doctor's appointment where, they were told that they should no longer drive. So it is a great opportunity to kind of set the stage for restricting or limiting driving and or starting the process of taking the steps to stop the person from driving. The other great thing that it can happen with this is, it is kind of putting the doctor in the role of the bad guy or the bad lady. And, doctors are oftentimes okay with that happening. And with this whole issue of driving, ultimately, it's better for somebody other than the primary care partner, and preferably somebody outside of the family, to be the bad guy. If a bad guy, has to enter into this, to be the one that says, no more driving. The other thing that is really important for all of you to be aware of and to give serious consideration to is the whole thing of insurance. Now, if a doctor, a medical professional who has diagnosed an individual says, I recommend that you no longer drive, that will be going into the written record, the medical record of that person. And while medical records are confidential, there is a possibility that that could, in the event of some catastrophic accident, that that information could come to light, and it could result in some serious financial repercussions for families with, insurance not covering an accident. And if it was a catastrophic accident that involved a fatality, that opens up other areas for lawsuits and such, if it has already gone on the medical record that it was, fully explained to the person and the care partner and the family that the person diagnosed should no longer be driving. So absolutely take these things real seriously, folks, and look at how you can work with the doctor to figure out, the ins and outs of this and what's going to work best for your person who's been diagnosed. Okay, to the Department of Motor Vehicles. So the physician has made the report and has either elaborated on it or maybe not. It's gone to the Department of Public Health, and now it's gone on to the Department of Motor Vehicles. So what do they do with it? They, again, don't have a one-size-fits-all response to this. It's really highly individualized. And I really want to state that really firmly, because again, there is a misperception that it's just, they get that report and bada bing, bada boom, that's it, you're not driving anymore. And that is not the case. The DMV looks very carefully at these individual cases. And so they may, based on their determination, they look at everything from your driving record to when are you next up for a re-examination or a new driver's license or whatever it may be. Obviously, they're looking at the report they received from the physician. And then they're kind of pulling all this information together to make a decision on next steps. And you may receive in the mail, you may receive nothing. You may not get a word from the DMV. And generally in that case, it's a kind of no news is good news. They have decided there's nothing to worry about right at this point in time. They will address it at another point, perhaps later in time, when it's time for you to renew your driver's license. But these are some of the things that can come of that report and some of the things that are available to you folks. So, and do a written exam again. And they can also ask you to come in and do a written and a driving exam again. And that's often determined at the time that you are appearing there at the DMV office. And so again, it's very, based upon whatever DMV officer or employee that you are dealing with at the time. And, also kind of what kind of a day you're having. So you do want to try and be well rested and feeling good on the days that you go on for these things. If you have a problem with a written or a driving test and you fail it or don't do very well at it, you have opportunities to put in a request for a re-examination. So you have avenues to get a redo on this and give it another try. Please know that the DMV does have an Office of Driver Safety. And in addition to the DMV offices themselves. And this office is actually often where you are going for these types of written and driving tests and or re-examinations. And also happening at the Officer of Driver Safety is the administrative hearings. And so the administrative hearings is when it is starting to get a little bit more complicated. And this may be where you are appealing, looking for a reexamination or appealing a decision that has been made, and or perhaps the DMV is willing to give you your driver's license, but with specific restrictions on it. And that does happen. And it may be restrictions like no nighttime driving, no freeway driving, driving only in your own neighborhood during daytime hours. So this is where these kind of administrative hearing and these more specialized, a little bit more complex situations are being outlined and communicated to drivers. Of course, ultimately, the DMV, in addition to law enforcement, have the legal authority and power to revoke a person's driver's license. And that does happen. And sometimes it's the DMV doing it, and sometimes it's law enforcement doing it on the spot when there's maybe been, an incident of serious consequence. In all of this, know that you have another resource at your hands available to you, which is the Senior Ombudsman for the DMV in Southern California. And this particular person is the advocate for senior drivers in Southern California. And you can contact this person. We'll have contact information coming up towards the end of the presentation. And that is what this person is doing, is acting as your advocate and go-between between yourself as a senior driver and the DMV. So don't think for a minute that you're getting this person is a spy for the DMV or you're getting biased information. You are not. And ultimately what I'll say is this, and you'll see this right on the DMV website, and it makes sense, folks, is it is in the DMV's best interests and the public's best interests to keep safe senior drivers on the road for as long as possible, and that includes as long as they are safe. And under all of that includes people with dementia to a point in time. Getting that diagnosis of dementia does not mean that you have instantly lost all of your abilities and skills to drive safely. So it's a step-by-step process, and it's a very individual process, okay? So driver evaluations, who does them, where are they done, how are they done? Well, there's a variety of resources that can do these driver evaluations. And rehabilitation departments at different health organizations are common, and they're often available there. So again, as a resource, you'll see coming up a little later, most of our health institutes have rehabilitation departments, and many of them have actual specific driver programs. And that includes Scripps, and that includes Sharp. And there are some others that kind of come and go a little bit depending on funding. And it's usually occupational therapists that are acting as the evaluators, the assessors in these evaluations through these rehab departments. And again, I will go into more detail on these specific resources towards the end of the presentation. But that most certainly is one place to start. There are people out there who are called certified driver rehabilitation specialists. And actually many of these occupational therapists are precisely that. Some of them, though, in addition to what they may do in a rehab department or for a health organization like Sharp, some of them are also work privately, and that you can hire them privately and pay out of pocket to have them do this type of assessment individually for you and or a family member. And then, of course, you can get on the road driving evaluation by the trained Department of Motor Vehicles personnel. And so that is something that is available as well too. And it's something that you can request through the DMV. So here's the thing in the end. When the individual poses a serious risk to themselves or others with their driving and or the changes in their driving skills, they must stop driving. And it's difficult for us to see that and read it and hear it, but it's the truth. It's the truth. And ultimately, folks, if we all live long enough, we're going to outlive our ability to continue driving. I actually read on one of these websites today, I want to make sure I get it right, a quote. This is from a medical professional who, has some specific work in dementia and assessing people for driving. And he says, most individuals outlive their ability to drive by a decade. We're not talking just about people with dementia. That's all of us. That's the population at large. Most of us outlive our ability to drive by a decade. So this is something we all have to be talking about and planning for. So how do we start planning for it? Well, start preparing to stop driving. I mean, we start preparing to start driving, right? Either, our parents or an uncle or an aunt or a friend or somebody got us started driving in a car somewhere, maybe in a field or in a parking lot or somewhere. And at some point we would have had some kind of driver's information in front of us to start looking at to prepare for the exam. I think about how many other things we need to do some preparation for in order to, whatever it is, get that license or whatever it is that we're looking for. So we need to do the same thing here to prepare to stop driving. So how do we do that? Here, I think this is a terrific one. Practice being a passenger. And I want to ask, and feel free to put anything in chat as you wish. How many people here either would acknowledge that you yourself, it would be hard for you to practice being a passenger, you like to be in the driver's seat, and or you have a family member or a partner or a spouse who you would describe as that. They don't want to be the passenger, they want to be in the driver's seat. And I certainly would raise my hand about having a family member like that. And that would be my husband. So for him, as we are growing older, it's important for me to ensure he gets some practice time being a passenger. And there's some really neat ways to go about doing that. I'm just going to tell you a quick one here that a family told us about some time back. And it was the grandson who stepped in to help. I can't remember if it was a grandmother or a grandfather. And the young grandson, maybe he did have his driver's license, I don't know, but he was younger. And so the family concocted this plan to have the young grandson start doing some driving for the grandparent. And the grandparent was reluctant to give up the driver's seat, but how they went about it was the grandson said, let's just say if it was grandpa, said, Grandpa, I need practice before I take my driver's license test. So will you let me drive so I can get in some practice? Grandpa was happy to accommodate the grandson with that. So that's how they started managing this practice part of things. And, it went on for some time. But Grandpa would forget about these times that the grandson was driving. And that, that was used to their advantage so that the grandson could keep coming back and saying, I need more practice, Grandpa. So that's how they did it. You can restrict driving, and you can either manage that yourself or as a family, or again, together with the doctor, or the DMV might do it for you. I'm a big fan of proactively doing these things. And I can tell you that my husband and I have already started restricting our nighttime driving, because our nighttime vision, both of us, is not as sharp as it used to be. So we're starting to restrict nighttime driving. You need to start looking at how to reduce the need to drive. And that means looking at, what resources and supports are available. And that's everything from the family and kind of the safety network around that each of us have around us, to what you have in your community, your neighborhood, your broader community, your natural supports like churches, volunteer groups, things like that. So reducing the need to drive while building sources of social support. People still need to get out and about, and that's important. It's important that we sustain our seniors and our people living with the diagnosis of dementia, to sustain their ability to participate in and move within the communities. We don't want people social isolated. So again, you can look at driving agreements or family contracts. That can help, where if you have something written down that has been agreed upon and the person living with the diagnosis has signed it, that can be something you can bring out. If there's some pushback on it or some disagreement, to say, okay, Dad, I know you would like to drive today. We had this discussion on January 1st of this year. We all agreed and signed off on it, and you did too, that you would no longer be driving. So to just kind of pull that out and very calmly and matter-of-factly show that this was an agreement that the person participated in and agreed to and signed off on. Again, exploring what all those different options are for outside help, and then starting to develop a personal plan. Everybody kind of does things differently. Some people like to rely on some of the volunteer-based programs. Others have a good social network within, appropriate distance from the home, and can set things up that way. So you really need to look at a personal transportation plan and what's going to work for you. And now I'm going to ask Serena to come back in and just join me for a minute. And I'm going to show all of you a couple of slides. And I just want you to feel free to put in chat your thoughts on things. So the first question we have is, what does driving mean to you? What do you think, Serena?
Gosh, driving, for me, it's independence, right? Getting in the car and going where I want to go when I need to.
Yep, I would agree.
How about you, Jean?
Well, I would agree with independence. And look at all these other words, and all of you, again, feel free to put your thoughts in chat for us. For whatever reason, the two words that really resonate with me, I've mentioned this one a couple of times already, is identity, is just that, it's not like the car is who I am, but it's symbolic of, I don't know, just my all of these things, my freedom, my adulthood, my responsibility, my role, work-wise as an educator around the county, pre-pandemic and starting up again now around the county. So it kind of driving serves to supplement a bunch of different things for me.
Yeah,
And
I like
ahead.
Nancy had said convenience. That's a great word.
I like this one too. Look, clarity
Mhm.
offers a way to think without thinking when driving for me. And you know what? I actually would agree with that. I oftentimes don't have music on, or I'm usually alone if I'm driving, certainly during the work week. And I actually really like the quiet time, often to think things through, think things over. So I can appreciate that clarity time. So, all right,
Excellent.
well, let's see here. What are some of the fears that we have over the thought of not being able to drive ourselves anymore, not have that independence? I mean, I would just say having to rely on others, it's not agreeable to me.
Mhm.
What about you, Serena?
Yeah, I agree with you, Jean. Relying on other people and having to work with their schedules and really having someone else always be a part of your life, right?
Yeah.
You can't schedule things the way that you did before, and somebody always has to know kind of what you're doing.
Right. And why? And, that's something that Amy and I have talked about in this class. It was something another person actually brought up, if I recall correctly, but it's loss of privacy. So
Right.
it's like you want to go somewhere
Mhm.
and whoever it is you're talking to, whether it's a family member or a neighbor or a member of the church or a volunteer, you kind of got to state the where you're going to go and the why. So, well, want to do that. What if it's kind of, I don't know,
If it's
maybe,
personal, right? Or if,
yeah,
you're going to the
maybe,
doctor, it starts that conversation where, why are you going to the doctor and what's going on?
yeah, maybe I
Yeah.
want to go to Kentucky Fried Chicken and get a big old bucket of fried chicken. And I'm kind of embarrassed about that because, I feel like I'm going to be, told that's not good for you, so.
Mhm.
Or what if I'm an older lady and I want to go see a male friend that I've met, and I don't want to tell my family member that. Maybe that's just
Yeah.
my business. So there's
Right.
loss of privacy. The whole idea of these two slides is for all of us to put that lens on ourselves so that we can have some really good and true empathy for the situation of being the person who's being told, we got to make a plan here for you to not be driving anymore, or you shouldn't be driving, or you can't be driving anymore. It's a tough thing.
Yeah,
And
but it's important,
so,
right? It dignifies the person experiencing memory loss to know that you do see them and you
yeah,
do
absolutely.
acknowledge how they're feeling and how much they may be losing or feeling like they're losing when they have to give up their license.
Absolutely. So just stick with me here for a moment. Serena, we've just got a couple of questions. I'm just going to go through a couple of slides here.
Okay.
So, what we want everyone to do is be preparing for, yes, that road ahead, which means doing what we've just asked you to do, to consider the meaning of driving, what is important about it for you, and your fears or other people's fears about not being able to have that ability to just take themselves wherever you want to do. Keep a detailed written record of observations if you are seeing changes. It's a better thing to go into a discussion about this with the person with dementia with a detailed, factual, written record of observations, rather than, to make it a more fact-based discussion rather than an emotional discussion. You're a terrible driver. I've seen it, Dad. You drive too fast. You tailgate people. You follow too close, and so on and so forth. It's best to have some real specifics. And before you get into any of that conversation, do your research so you've got some good information about how to get a driver's evaluation. What are the transportation alternatives? We always say you can't take something away without giving something in return. So, and certainly this is one of those areas. We don't want to be talking all about how we're going to take your driver's license away or restrict your driving without offering some positives in return. Yeah, we're going to restrict your driving, and here's some ideas about how you can still be independent. Get your support, including professional assistance when needed. And that includes us at Alzheimer San Diego for sure. So ultimately, what we want to say is that personal and public safety is more important than any one person's emotional state. And I'm going to quote Amy Abrams. She's our director of education at Alzheimer San Diego. And she often says with this particular statement that she's never seen a family fall apart over this driving issue. Tough as it is, she's never seen a family fall apart over all of this. And I would agree with that and say the same thing. How about you, Serena?
Yeah, absolutely. I see, families might have some conflicts, but to definitely not fall apart. It's a hard conversation, but it needs to happen.
Yep, I agree. And so, we'll do whatever we can to help you get through the tough stuff. But personal and public safety supersedes all other things. So what do you need to do to take the steps, take action? You may need to request a re-examination from the DMV, which you can do. And you can do that anonymously as well, too. And you may need to control access to the car and the keys. And that might mean removing the car from the environment, from the garage or from the driveway or from being out in front of the house. Sometimes, out of sight is out of mind. But access to car keys is important too, because if the car's out front and the car keys are sitting in a tray by the front door, I don't know, that's just kind of an invitation, right?
Yeah.
So yeah, disable or remove the car. Contact law enforcement if need be. And this may sound harsh, but here's the thing. If your person or another person you saw, if you suspected that they were drinking and driving, that this was a person who'd been drinking and was now driving, you would call law enforcement, right? Because we don't want that driver on the road for everybody's safety. You just think all the disastrous things that can happen. Well, it's a different scenario. Dementia is not like being drunk while driving, but the same kind of catastrophic situations can occur. So contact law enforcement. If your person finds the keys or takes the keys, or we've had some very intrepid people diagnosed with dementia who, even though the car has been disabled, they've called AAA and had a new battery installed and all sorts of things like that, where families have had no other option but to call law enforcement and say, my dad, we did A, B, C, and D to prevent him from driving. He was able to get around all those things. He's got the car running. He's out driving right now in the neighborhood of whatever it is. And the police will get out there as they can. And if, they have to pull him over and kind of apply the law specifically to the situation, then maybe that's what needs to happen. And of course, plan your transportation alternative. So for some questions, Gabby is with us. What you got for us, Gabby?
Gabby had mentioned that she's having some microphone issues.
Oh, okay.
I know, darn technology.
Right.
But I did see in the chat that there were some questions about initiating conversations on and how to reduce them, reduce driving privileges with people with dementia. What would you suggest, Jean?
Well, I think I would do just as we've been talking about is, first of all, have a plan in mind. Don't just jump into the conversation. So
Yeah.
have a plan in mind. Map it out in your head. Make yourself some notes if need be. Arm yourself with some statistics. And, a way to initiate might be, I'll use my husband and myself as an example. We're very close to the same age. So in which case, if he's diagnosed with some type of dementia, what I might approach him with is, look, you've got a diagnosis of dementia and, but we're both older, getting to be older drivers too. So we both need to come up with a plan on how we're going to transition from being drivers to being non-drivers. So statistics show that, we're at greater risk of being involved in crashes, and statistics show we're at greater risk for really serious injuries. So we're, in other words, I'm not making it about him necessarily or me necessarily, but kind of the broader area.
Mm-hmm.
And so I've looked into things, and my suggestion is, let's start restricting our driving to ABC, and let's start trying these transportation options for those situations, with the goal of ultimately transitioning to being a non-driver. So in other words, make a plan for how you're going to approach the conversation and initiate it. Make it not personal about the person in as much as possible. Make it a plan for both of you, if possible. And, just keep it kind of calm. What you want to do is try and get the emotion out of it as much as you can. And if that's proving hard to do, which often is with driving, then look to those outside sources to, again, come into the role of being the bad guy, which would be the doctor, the DMV. We don't want our care partners to be the bad guy in this, because you'll hear about it all the time. It would be much easier for you to be able to kind of commiserate and empathize with your person with dementia, that darn DMV took away your driver's license. I know it was really frustrating, and you're upset about it. I absolutely am hearing the frustration you're voicing. So I hope that helps. What do you think, Serena? What would you add?
When it comes to this topic in particular, it can trigger a lot of individuals, especially like I mentioned with my grandfather. He knows cars, and so trying to take that away from him, I completely agree with you, Jean. There needs to be a plan, and the emotions need to be out of it. But if you find yourself in a situation where maybe you and your siblings disagree, or you and your children might disagree, or have an issue, always feel free to call our organization. Our team of clinical care coaches are happy to be the professionals. We're happy to have a family meeting and get everybody together and have us be the bad guys, or have us be the ones to talk through this and really figure out what is everybody's concerns, what are their fears, because really everybody wants the best for the person experiencing memory loss, but we might not always communicate well with one another. So I would encourage just using our resources.
Yeah, I totally agree with that. So, and I just had a quick look here in our Q&A section here. I'm going to talk about resources right away now, so you'll get some good information there. Again, remember, you'll get a copy of the slides in an email later this evening that will give you some ideas. There was a comment about hiding keys for this particular caregiver doesn't work, because he just gets angry and upset and gets, kind of in her face and demands them. And in order to avoid further, adding fire to an already upset, angry person with a diagnosis of dementia, that she gives him the keys. And this may be a scenario where you do have to, pull in whoever the bad guys are going to be, so that it's not you, because we don't want you to be the focus of that anger. So that, again, that might be a suggestion for you to follow up with Alzheimer's San Diego with our clinical care team, so we can talk about some different plans for you. But I'm going to go on now and just talk about some of the local resources we have, which are many, and they are really good. Thank you, Serena. Thanks, Gabby. Okay, so what are they? Let's just see what all we've got. So some of the alternatives for transportation are, as we describe them, these demand responsive services, which is taxis. Taxis have always been around and they haven't disappeared. My understanding is actually taxis are maybe making a bit of a re-emergence with some folks, certainly in some specific areas where it's a little bit easier to get a taxi. Perhaps in some of the more downtown areas or poor areas around there. Pardon me. There is Uber and Lyft. I'm sure we're all familiar with these ones. You have your app on the phone and you request a driver and they have one sent out to you. One of the challenges that I'm hearing about more about Uber and Lyft as options is that oftentimes drivers are accepting the request and then canceling it. And multiple drivers are doing that. So you're sitting there waiting and you've had 4 drivers cancel on you and you're still waiting to try and get a driver. So I think that's part of the reason why taxis are maybe kind of coming up in why I wouldn't necessarily say popularity. The use of taxis seems to be on the rise. We do have a paratransit system here in San Diego County, and it is a quite a good one. So this is an option. We'll go into a little bit more detail shortly here. There's a variety of volunteer-based programs, many associated with nonprofit organizations, and we'll talk about how to access those ones as well too. There are transportation services that are activity specific or location specific. And that can be something that is a part of your transportation plan too. There are private transportation services that you can hire. And of course, there's family, friends, and these other natural supports we have in our lives. And I think, probably the most successful transportation plan probably uses a combination of these, maybe not all of them, but kind of a combination of these. It's great to use family, friends, and other natural supports, but of course, we always run the risk of not being able to have somebody available to us at a time where we really would like to have someone or need someone, because they're busy with work, school, other things going on in their lives. So I think it's good to have a couple of options available to you in your transportation plan. And so here we go, the Metropolitan Transit Systems, MTS, access, and this is the ADA Paratransit Program. And it's really quite good here in San Diego. This is the website for it, adaride.com. And you'll be able to get all the information you need at that website and to find out how to go about getting approved for the paratransit program and getting your ADA card to be able to participate in that. base, the Facilitating Access to Transportation, FACT transit database, is really quite fantastic. So it is a database, and in it, there are transportation programs from all different areas, including the volunteer-based ones, and including the ones that are specific to activities, and also specific to, for example, people going for chemotherapy treatment for breast cancer, and seniors who are going to see their doctors, and groups who are looking to go to a senior center or an activity of some kind. So kind of, you name it, you think of it, you'll probably find it in this database. And when you get on the database, you have the option of writing in then what you're looking for, where you're at, your zip code. And so, for example, I put my zip code in, and it pulls up all the different transportation options that are available here to me in Mira Mesa. And so then I do need to go through them and say, okay, I don't need the option for breast cancer patients going for chemotherapy. And I don't need the option for a shuttle to the senior center. You know, I have to kind of curate it down to the transportation options that look like they're best suited to me and of the type that I am needing. So it's a good way to find out what you have available locally to you. And one of the good things about that too is, you know, there may be church-based transportation programs, things very specific to your neighborhood that could be in here. Ride Fact. This is a general purpose trips for seniors, identifying seniors as being people 60 plus. It is available. The trips are, the website is, and the trips are 7 days a week, 7 a.m. to 8 p.m. And this is part of the FACT database. Jewish Family Services, on the go. And that's kind of their overreaching name for a bunch of different transportation programs that they have. That includes Rides and Smiles, which is a volunteer-based program. They have a Navigator program, which utilizes Lyft, but it's kind of a specialized Lyft program. It's got a little bit more meat to it. And then there's others like On the Go Silver, which is a fee-based door-to-door service. And so you can go to the website for Jewish Family Services, as it's listed here, to see what is available through these good folks. For driver evaluation resources, the American Occupational Therapy Association, the AOTA.org, has their driving and community mobility information section. And lots of good information here. I'm absolutely, seriously not kidding you when I say, I think it's good for everyone to take some time after you get the slide deck from me a little later today, maybe sometime tomorrow or Friday or whenever, to sit down and go through some of these websites. There's really good information here, folks. Local driver evaluation rehabilitation programs available through, I mentioned these earlier, Scripps driving program and the Sharp adapted driving program. So what do these folks do? Well, what they do is a clinical assessment of the person who, you know, is looking for some driving rehab and or support. So a clinical assessment, they have driving simulators that they have people sit in, and, you know, I mean, it has all the instruments of a car and looks like you're driving down a road, and there's the mirrors and such. And so the simulator is looking at your driving performance. They also have on the road test vehicles with dual controls in the car, you know, with the brakes and the gas and such on the passenger side for the evaluator. Now, oftentimes these programs are targeted for people, for example, who've had strokes or just other medical things have happened to them that has impaired their ability to drive. You know, maybe a person is partially paralyzed and so has limited mobility and limbs and need to do some adapted driving. But this also does include, they do have some pieces and parts of these programs specific for people with a diagnosis of dementia. And while rehabilitation is not the end goal of the programs for people with dementia, they are still able to assess and evaluate, and that can be very helpful. Usually a medical provider order is required, but sometimes you can go privately and just pay out of pocket for these programs. They are good programs. Here's safety information. Through the California DMV, you go on their website and find Form 699, which is the request for driver reexamination. And this is also the one where you can check the box that says you prefer to have this done anonymously, so that when the DMV is sending notification to the person you're reporting on, they're not saying, oh, it was your wife, Sally, who told us about this. So you can keep things under the radar. They have a great senior driver guide available on their website. And again, it's through the DMV that you can access the Ombudsman program for Southern California. And this is an updated number for you here listed on the slide. The AARP has a driver safety program and lots of good information. Check that out. Same for AAA, American Automobile Association. And if you get your insurance through them, I think you'll get some, you know, rebates, changes in your, to make your insurance costs a little bit lower. This website, the Insurance Institute for Highway Safety, Older Drivers Information Center, is really terrific. There's so much good information here. And this is where we get some of our statistics that we reported on earlier in this presentation from. And lots of other good information here too, though. So I, again, really encourage you to take some time and do some exploring. You know, I mean, all of these websites are going to help you to formulate your plan for initiating this conversation, having this discussion about stopping driving, planning for it. There's all sorts of tidbits in all of these websites for those tough conversations. So just like you did when you were back in school, folks, I mean, do your research, and then draft the outlines of your paper, as it were, before you step into the discussion. For advocacy and information, freewheeling after 60. And what this is about is helping you to craft this personalized transportation plan for yourself and, you know, your spouse or your partner or your family, whoever it is. And some good tips and ideas on that website. The Hartford Center for Mature Market Excellence has a great booklet that you can download on their website on driving, and again, having that tough conversation and the things to consider and how to plan for it. And in addition to that, they've got lots of other great resources on things like emergency planning and fire safety and earthquakes and other things. Really good source of information. The National Aging and Disability Transportation Center, NADTC.org, and the National Highway Traffic Safety Administration, nhtsa.gov. So again, where you can go to get additional information, you can get some statistics too. And sometimes the statistics can be a part of the plan to illustrate why we need to, or further illustrate why we need to be thinking about the plan and how to exit from the driver's seat for the last or close to last time. So we're starting to wrap up here, folks. Here is Alzheimer's San Diego. We do a bunch of different things. I think most of you probably know that. We've been saying, talk to a dementia expert. Gabby's been putting that out in chat to fill out our form or give us a call or go on our website. And, you know, we've got support groups as well too, still meeting virtually. But we've got one for you. We've got over 30. We've continuing with our online education and training. We're also starting to slowly make a foray back to some in-person training, which is very exciting. We have our volunteer tech team, and extra special thanks to Chris for today. We have social activities and outings going on. You can find out about those. Are you there, Chris?
Yes, I am. Thank you.
Great. We have social activities and outings going on. You can find out on our website as well too. We partner with local research. Have a look on our website and under events, and you'll see information about our date with the cure coming up in June, where we sit down with the panel of researchers to find out what is the latest and greatest, local researchers, San Diego people, to see what is the latest and greatest going on. We have our Respitals Companions program, volunteer-based. Our Vitals program, also volunteer-based, where we have volunteers staying in touch by phone with people living alone in the community. And again, all the different ways to get in touch with us. We've got some upcoming online education going on next week. That's next week, next Wednesday, Managing Resistance in the morning. And we've got a Spanish presentation Wednesday, also on the following week, Wednesday the 20th, on looking at the symptoms of dementia in Spanish. Long distance caregiving towards the end of the month, April 29th. And of course, details and pre-registration on our website. So as always, we very much value your feedback. You will get a link to an online survey when we wrap things up. I will get a copy of today's slides and some other materials emailed to everyone. And again, be looking for the recording of today's presentation in our webinar library in just a few days. I'm going to ask Serena and Gabby and Chris to come back on if you would. And we just want to say thank you to all of you for your contributions here today. Very important and very valued.
Thank you, Jean.
You're welcome.
Great. And we'll be back. We'll see you all again next time. It may be all of us or maybe some different faces, but you know, we're here, and we invite you to keep coming back to us, and we're happy to be supports and resources and part of your network. So that's what we're here for, folks. So take care, have a good evening. We'll talk to you all later, and stay cool, hydrate. They say we're in a heat wave now. All right, take care, everybody.
Thank you, everyone.